Good morning, my name is Jin Zhang. I will report the problem in NHS, book appointment problem from NHS, and the advices from the citizen in UK. First revolution about the computer system from NHS that will encourage them by the advantage computer management from America or China, because both America and China hospital have already updated their patient management. They will counting every citizen's ID card and their disease history. So the hospital, so the nurse can easily find everyone's disease history from computer, and additional, the nurse can easily go to the patient's disease background. So when you book an appointment, the nurse can quickly give you advice which department or which doctor should you meet with them. The safety strategy. We are committed to issue the strategy remains focused on activity that we will have the greater impact on patient safety improved. That also is my business opportunity to earn money from NHS. I will create a computer system to help NHS to operate their patient safety system.
About distributing from the government wealth more into the NHS and less into other things, perhaps having it more as a social decision rather than a government-only decision, to put more into the pot that way, or charging for small things, perhaps, maybe doctor's appointments, but then that brings up a whole other issue. People be put off going when there's something serious happening to them.
If we could basically be sent a bill at the end of the month or year, delineating exactly where the taxes went to, i.e. this part of the tax went to this went to picking up the bins, and then basically provide some feedback based on there, then maybe through the democratic process we'll be able to funnel more money towards what the public actually believe to be important.
One of the things that we came up with was actually having like a community health officer in a similar way that the police service has a community officer that just deals with general problems. If the NHS had some kind of community officer that was at a family planning clinic or was just able to educate people on everyday things, kind of like how Embarrassing Bodies, that programme about health, operates, going out asking the public things and just giving them really quick, easy advice.
The money that we're spending on the NHS is a good amount. We shouldn't have to pay any more or any less, but we should know exactly what money is going towards every sector in the NHS. You know, that there's not some management that's getting a ridiculous amount of money and some poor nurse is not getting enough money. And that really, for people to take more responsibility of themselves and their lifestyle, and that if you smoke or drink and exercise, rubbish diet, that if you were told you have to pay for your health care, that maybe you might look after yourself a bit more.
In the internet age, policy making and decisions about policy should actually be more important to the people a lot more regularly and a lot more closely. Conventionally, policies get put before the public at a general election. But there's no need for us to do that now, because we've got into the internet, and the internet allows us all to have.
Start the second problem about treatment and diagnosis. My advice is send some doctor and nurses study from America and China. They will know how to deal with the disease, because America hospital system and Chinese hospital are more effective than UK. The result has a gap around 900 million in NHS. So how to take this problem? I had three advices. The first advice is increase the NHS trust in England. Healthy Foundation also can increase their donation from the social organization, attract more investors from other countries such as China, Germany, America, and the advanced hospital management was America and Germany and China. So if they can attract attractive more founder from rich organization or rich or wealth company. They will give a lot of support from the capital foundation. Third advices from the international capital investment. The UK hospital should attract more investors from other countries such as China, Germany, America. As you know, the advanced hospital management was America and Germany and China. So if they can attract more founder from rich organization or rich or wealth company, they will give a lot of support from the capital foundation. NHS England is short of tens of thousands of doctors, nurses, and midwives with the prestige undergrad. How to resolve this problem? I have two ideas. The first idea is change the immigration policy. What let the Home Office give more work visa to nurses from other countries. The second idea is education the children from kindergarten. They should build the positive value about to be a nurse. I'm so surprised. As you know, the famous woman who is Nightingale was the original British woman, but today no woman want to be a nurse. I think the education value was a problem from England education system. So they should change their education value, encourage more girls to become nurses in UK.
Behind the media, he needs to get into a room with me and discuss it. That's the respectful thing to do on behalf of the profession, and he needs to do it before the end of this week. Otherwise, I fear we're going to end up going into a new year with escalation of industrial action that none of our nursing staff either deserve or want to do.
Patient safety is at risk every single day because of short staffing numbers.
We need more staff on the ground to look after the patients day in, day out, night, days, weekends.
You know, the nurse strike happened often since last year. My advice is the government should increase their salary. Absolutely, the nurse salary is too low in UK. On another way, the NHS system should responsibly with the patient service. If the patient was died during the strike by nurse, they should get a punishment and get a compensation if NHS is no responsibility for patient during strike time. Overall, my business opportunity has three chances from NHS system. The first business chance is computer system change to change their data and the patient safety from my service. The second business chance is recommend nurses from China or Philippines or another country. I will be an agency to support the nurses from other country immigration to UK. The third chances is sell the medicine book and knowledge to students in UK. I recommend the student who from kindergarten or primary school to study nurse skills and give the positive value from kindergarten. Then, after 10 years, some of girls would like to be a nurse in UK. See, there are more and more immigration citizens from China and India. I think sell the traditional Chinese medicine to UK also is a good business. To achieve my business goal, I need £1 billion. So please invest in my company. I will give you more profit to return your funding. Trust me, please. You will take the huge benefit from my company. As you know, there are lots of problems need another support from other countries and from others' new ideas. Let's cooperation a successful business in UK.